I didn't believe in that things could get better, and I had lived the life I had, so I had almost adjusted to that lifestyle. So he had to actually convince me that you need to try something else out, and he's right.
Welcome to Unconventional Conversations. This is the UC podcast that unpacks the treatment challenges that many of us face.
We have moderate to severe ulcerative colitis, and we know from experience that asking the right questions can lead to discovering the right treatment and the next right step. We're excited for our guest today. It's Sarah, who is also a UC patient.
Hi, Sarah.
Welcome, Sarah.
Thanks for having me.
So the topic of our discussion is, how do you know when the treatment that you're on is not adequately controlling your symptoms?
I think Doug and I would first like to start on hearing about the early days and what those symptoms were like.
Yeah, well, I had frequent bowel movements, and I had, blood, of course, when I was going to the bathroom and, feeling really lethargic and not feeling like myself. Like, I started calling out from work. I could not go to my classes at college. It had become unmanageable at that point.
How long were you dealing with that, of the uncontrolled symptoms?
Yeah, that's the thing. I let this go on for quite a long time.
You didn't change any medicine? You were on that same one the whole time?
Right. I didn't really believe in another medication working because I hadn't experienced it.
But there's more to your story. So now we're going to welcome your husband, Sam. So Sam, come on in.
Welcome to the program, Sam.
Hello, great to be here.
Where were you in your whole journey when you met Sam?
Yeah, I wasn't at the worst state that I had been, but I was still not controlled. It really became real for him when I was hospitalized. That's when he really understood how severe of a disease I had.
I wasn't really too worried at the doctor appointments yet until we actually are in the hospital part of it, and we're sleeping over, and they're doing all of these tests, and then they're asking about the medications that she say, what are the symptoms? And I'm like, wow, that's some serious symptoms.
Did you guys start making the decision together? I think you need to change doctors. This doesn't seem right.
Yeah. When we were going for an appointment after that she got hospitalized, when we were going to the doctor, I'm like, listen, she's in really bad shape. We need to get her on this so she gets seen so she can get a different medication.
You ended up finding a new doctor for Sarah, Sam. That was amazing.
Yes.
What was the interaction with that new doctor? How was it different from the first doctor?
I think it was immediately that we saw that they were actually listening to us. What are the treatment? What's the treatment plan?
Yeah.
What is our goals here?
I love that they made goals.
Yeah.
Mm-hmm.
Yeah, it was the first time somebody actually asked me what I wanted and what I kind of saw as this is what I want out of my treatment.
Why were you so confident that things could get better?
I think after you're doing your research, you see that there are people out there that are in remission. You don't want to just settle for it. You got to keep fighting for what you think is right. How
did Sam's support help you in thinking about how you're going to change doctors?
I think he really encouraged me to kind of see the other side, which is you're not okay. He kind of talked to me often about, well, you can't just accept this, eventually kind of stuck with me. I saw that there were other options for me, whereas before I had just accepted how things were.
What would you tell somebody that was not having that symptom control like you dealt with?
I would talk about what I went through, and I would tell them to not settle.
And what about you, Sam?
If you see other people or other medications out there, don't be afraid to mention it yourself.
So we're going to jump now to one of our favorite segments, and that is the old thinking, new thinking. So we want to kind of hear your thoughts on how you used to think about inadequate symptom control and how you now think about inadequate symptom control.
I felt like if I tucked it away and kept going, that I would be okay with it, that I could just accept it and move on. And now, I understand that didn't make me strong. Not seeing hope, that did not make me a stronger person. And now I see it as by acknowledging what's going on, I am stronger. I'm honest. I'm upfront about my condition. You're really strong when you share your story. You're strong when you're open about what's going on, not only to your friends and family, but to your doctor. You're open about, I'm not okay. And that's how you really get to where you need to be, where your symptoms are controlled.
Sam and Sarah, thanks so much for being on our program today.
Thank you for having us.
Thank you so much for having us.
If you're experiencing inadequate symptom control with your current treatment, talk to your doctor. Take action now.
Use. RINVOQ is a prescription medicine used to treat adults with moderate to severe ulcerative colitis when one or more medicines called tumor necrosis factor, TNF blockers, have been used and did not work well or could not be tolerated. It is not known if RINVOQ is safe and effective in children with ulcerative colitis. Important safety information. What is the most important information I should know about RINVOQ? RINVOQ may cause serious side effects, including serious infections. RINVOQ can lower your ability to fight infections. Serious infections have happened while taking RINVOQ, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that can spread throughout the body. Some people have died from these infections. Your healthcare provider, HCP, should test you for TB before starting RINVOQ and check you closely for signs and symptoms of TB during treatment with RINVOQ. You should not start taking RINVOQ if you have any kind of infection unless your HCP tells you it is okay. If you get a serious infection, your HCP may stop your treatment until your infection is controlled. You may be at higher risk of developing shingles, herpes zoster. Increased risk of death in people 50 years and older who have at least one heart disease, cardiovascular risk factor. Cancer and immune system problems. RINVOQ may increase your risk of certain cancers. Lymphoma and other cancers, including skin cancers, can happen. Current or past smokers are at higher risk of certain cancers, including lymphoma and lung cancer. Follow your HCP's advice about having your skin checked for skin cancer during treatment with RINVOQ. Limit the amount of time you spend in sunlight. Wear protective clothing when you are in the sun and use sunscreen. Increased risk of major cardiovascular CV events, such as heart attack, stroke, or death, in people 50 years and older who have at least one heart disease CV risk factor, especially if you are a current or past smoker. Blood clots. Blood clots in the veins of the legs or lungs and arteries can happen with RINVOQ. This may be life-threatening and cause death. Blood clots in the veins of the legs and lungs have happened more often in people who are 50 years and older and with at least one heart disease CV risk factor. Allergic reactions. Symptoms such as rash, hives, trouble breathing, feeling faint or dizzy, or swelling of your lips, tongue, or throat that may mean you are having an allergic reaction have been seen in people taking RINVOQ. Some of these reactions were serious. If any of these symptoms occur during treatment with RINVOQ, stop taking RINVOQ and get emergency medical help right away. Tears in the stomach or intestines. This happens most often in people who take non-steroidal anti-inflammatory drugs, NSAIDs, or corticosteroids. Get medical help right away if you get stomach area pain, fever, chills, nausea, or vomiting. Changes in certain laboratory tests. Your HCP should do blood tests before you start taking RINVOQ and while you take it. Your HCP may stop your RINVOQ treatment for a period of time if needed because of changes in these blood test results. Do not take RINVOQ if you are allergic to upadacitinib or any of the ingredients in RINVOQ. See the medication guide or consumer brief summary for a complete list of ingredients. What should I tell my HCP before starting RINVOQ? Tell your HCP if you are being treated for an infection, have an infection that won't go away or keeps coming back, or have symptoms of an infection, such as fever, sweating or chills, shortness of breath, warm, red, or painful skin or sores on your body, muscle aches, feeling tired, blood and phlegm, diarrhea or stomach pain, cough, weight loss, burning when urinating or urinating more often than normal. Have TB or have been in close contact with someone with TB. Are a current or past smoker. Have had a heart attack, other heart problems, or stroke. Have or have had any type of cancer, hepatitis B or C, shingles, herpes zoster, blood clots in the veins of your legs or lungs, diverticulitis, inflammation in parts of the large intestine, or ulcers in your stomach or intestines. Have other medical conditions, including liver problems, low blood cell counts, diabetes, chronic lung disease, HIV, or a weak immune system. Live, have lived, or have traveled to parts of the country, such as the Ohio and Mississippi River valleys and the Southwest, that increase your risk of getting certain kinds of fungal infections. If you are unsure if you've been to these types of areas, ask your HCP. Have recently received or are scheduled to receive a vaccine. People who take RINVOQ should not receive live vaccines. Are pregnant or plan to become pregnant. Based on animal studies, RINVOQ may harm your unborn baby. Your HCP will check whether or not you are pregnant before you start RINVOQ. You should use effective birth control, contraception, to avoid becoming pregnant during treatment with RINVOQ and for 4 weeks after your last dose. There is a pregnancy surveillance program for RINVOQ. The purpose of the program is to collect information about the health of you and your baby. If you become pregnant while taking RINVOQ, you are encouraged to report the pregnancy by calling 1-800-633-9110. Are breastfeeding or plan to breastfeed. RINVOQ may pass into your breast milk. Do not breastfeed during treatment with RINVOQ and for 6 days after your last dose. Tell your HCP about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. RINVOQ and other medicines may affect each other, causing side effects. Especially tell your HCP if you take medicines for fungal or bacterial infections, rifampicin or phenytoin, medicines that affect your immune system. If you are not sure if you are taking any of these medicines, ask your HCP or pharmacist. What should I avoid while taking RINVOQ? Avoid food or drink containing grapefruit during treatment with RINVOQ, as it may increase the risk of side effects. What should I do or tell my HCP after starting RINVOQ? Tell your HCP right away if you have any symptoms of an infection. RINVOQ can make you more likely to get infections or make any infections you have worse. Get emergency help right away if you have any symptoms of a heart attack or stroke while taking RINVOQ, including discomfort in the center of your chest that lasts for more than a few minutes or that goes away and comes back, severe tightness, pain, pressure, or heaviness in your chest, throat, neck, or jaw, pain or discomfort in your arms, back, neck, jaw, or stomach, shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea or vomiting, feeling lightheaded, weakness in one part or on one side of your body, slurred speech. Tell your HCP right away if you have any signs or symptoms of blood clots during treatment with RINVOQ, including swelling, pain or tenderness in one or both legs, sudden unexplained chest or upper back pain, shortness of breath or difficulty breathing. Tell your HCP right away if you have a fever or stomach area pain that does not go away, and a change in your bowel habits. What are other possible side effects of RINVOQ? Common side effects include upper respiratory tract infections, common cold, sinus infections, shingles, herpes zoster, herpes simplex virus infections, including cold sores, bronchitis, nausea, cough, fever, acne, headache, increased blood levels of creatine phosphokinase, allergic reactions, inflammation of hair follicles, stomach area, abdominal pain, increased weight, flu, tiredness, lower number of certain types of white blood cells, neutropenia, lymphopenia, leukopenia, muscle pain, flu-like illness, rash, increased blood cholesterol levels, increased liver enzyme levels, pneumonia, low number of red blood cells, anemia, and infection of the stomach and intestine, gastroenteritis. A separation or tear to the lining of the back part of the eye, retinal detachment, has happened in people with atopic dermatitis treated with RINVOQ. Call your HCP right away if you have any sudden changes in your vision during treatment with RINVOQ. Some people taking RINVOQ may see medicine residue, a whole tablet or tablet pieces, in their stool. If this happens, call your healthcare provider. These are not all the possible side effects of RINVOQ. How should I take RINVOQ? RINVOQ is taken once a day with or without food. Do not split, crush, or chew the tablet. Take RINVOQ exactly as your HCP tells you to use it. RINVOQ is available in 15 mg, 30 mg, and 45 mg extended release tablets. This is the most important information to know about RINVOQ. For more information, talk to your HCP.